All right, moving on, we have our first session of public comment. If there's anyone in the audience who wants to address the board, come on up to the podium now.
Okay, good evening. Hear me now? Okay, great, thank you. I'm Evan Resnikoff, the Chief of Newtown Ambulance, and I wanted to take a moment to speak on a few points early on in the meeting, knowing later in the meeting is the budget deliberation, so I wanted to bring a few things to the table for consideration when we get to that point. So the notion of any tax increase is unnerving, and it's politically unpopular. And I know there are some people who are not supportive of any kind of tax increase in general. So I wanted to put a few things into perspective in regarding to the EMS millage, which I guess by all definition would be a tax increase because it's a tax that currently doesn't exist. So using a historical figure that Mr. Ferguson has used as an average house value of $400,000, which is about $40,000 in a tax assessment, it works out to be about $18 per year. So we're talking about $1.50 a month tax on an average house, a value of $400,000 to support EMS. So while we're currently most thankful for that we receive support from municipal funding through the LST, which of course we don't want to see any support go away at any level, I want to address each of you tonight concerning our request to implement the EMS millage. So every year the township finds itself in a bind year over year at budget time, and our organization's funding is always a pivotal point when it comes to discussion about the budget, because the $120,000 we receive from the LST could be exceptionally beneficial in other areas of the township budget, and we agree with that, which is another reason why we would love to see us go back to the EMS millage. The LST, well, years ago when it was designated for 25% of that was funded for us, the LST collections were much higher when Lockheed Martin was here, when the economy was better. However, year over year, that amount's gone down, and it's become an unpredictable and potentially futurely unsustainable method of funding for our organization. Most EMS agencies in the county are not funded with the LST primarily. They're funded by EMS millage, which gives them a predicted budgeted amount that they can count on year over year. And most EMS agencies are funded at levels higher than we're presently funded at, as we had discussed 2 meetings ago, including some services that are providing less service or even running fewer calls than us at rates that are $50,000, $80,000, $100,000 more than we're even receiving. And again, we're the only single station EMS agency in the county that's providing 2 advanced life support ambulances at night, with our first primary unit up 100% of the time and the secondary unit up 88% of the time. And this is far and above what the minimum requirements are, but we know the community needed it based on our assessment of the calls at night and when the calls are coming in. So we did what was right for the community and not exactly what makes budgetary sense, but we're a community agency existing to serve the residents, and we felt this was the right thing to do. And we've seen some positive results of that. Aside from our salary and staff retention concerns that I've discussed at previous meeting, I want to briefly illustrate some of the other non-reimbursable expenses that your support helps us cover. And what I mean by non-reimbursable expenses, we cannot itemize bills for medical services, unlike a physician's office visit, unlike a hospital visit. We have 2 rates, advanced life support and basic life support, and whether we use $1,200 in supplies or $100 in supplies, we're going to get reimbursed at or below what we bill for, and that's pretty much a guarantee, especially with Medicare patients who we cannot balance bill. So, for example, our ambulances, we carry these intraosseous needles. These are needles that we actually put into someone's bone, in their tibia, when we cannot access a regular intravenous line. These needles are we use under the most dire circumstances, the sickest of sick patients, and they cost $150 each. Not only do we carry them because it's part of the standard of care, the Department of Health requires us to carry this equipment on the ambulance. Last week we had 3 cardiac arrest patients. We used it 3 times. That's $450 that we are paying for that we can't recover. This drug module is a small representation of some of the pharmaceuticals we carry on the ambulance. Each of our 4 advanced life support licensed ambulances carries about $1,200 in pharmaceuticals. This stuff expires and we have to replace it and pay a company to properly dispose of it because it's all tracked to the DEA. And some of these drugs where we previously would be able to exchange them for free at hospitals, we have to purchase ourselves, including our narcotics that we're required to carry. Stocking the narcotics requires us to have a DEA license, which costs us $731 each time we have to renew the DEA license under our medical director's medical license. More operational expenses that we can't control that we didn't used to have. We also currently have to pay our medical director a stipend for her services because she does take on some risk to be our medical director and oversee our EMTs and our paramedics. And while historically most EMS services were able to get that service donated by a physician, that's pretty much few and far between if we want to have medical oversight that's actually involved. So we pay her a small stipend of $6,000, which just about covers her CMEs for her license on an annual basis. So as I mentioned before, there's never been an EMS millage that received a no vote from the public. And that pretty much takes the temperature of the residents that they want to fund projects such as us. They want to fund service projects. It's not a frivolous tax, it's for public safety, and they can see the results, not just from our actions and our response in the community, but with us coming to meetings on a regular basis as we've done for the last couple of years. We're very open and accountable to the township, and our annual report, which we'll see every fall, will always have the open and clear information about our financial operations, our regular operations, our run responses, as well as the fact we intend to come to meetings every month to give an operational report to you, just as the police department does. So the EMS millage really has a twofold benefit. First thing is it benefits the township budget by getting it back to $120,000, which could go to any number of things where it's legally allowed to be used by the state. And the second thing is it gives us our steady, predictable, and sustainable financial municipal support that doesn't impact the township's budget at a higher rate than we're currently funded at to help with pay for pharmaceuticals, pay for these needles that we cannot get reimbursed for that we're required to have. So, as you deliberate the budget this evening, please, consider this. $1.50 a household on average, we're not talking about a lot of money here. And it's for a service that's openly in the public where you can see what we do every day. But, if someone were to burst through these doors right now with the intention to cause harm, I would think that you'd want the most trained senior providers to come through these doors to your aid with equipment that is ready, up to date, and current and good working order. And that's why we need sustainable, reliable funding, not like the LST, which we view as unstable, to be able to continue our operation. I've talked about our concerns with our salaries. I'm about to lose another paramedic due to salary, and when we're funded not like the other services around us, we can't keep up with that. Right now, we provide a high degree of service with some of the most senior and trained providers in the county, and we want to keep it that way. Newtown Township is becoming an up-and-coming destination. There's all this development in the center of town. There's more and more activity here, and we see it with the calls we're going on, and we need to be prepared for the increased development and people coming into town, and we want to continue to provide the service not only for the visitors, but for the residents of the municipality as well, at the same level or better level than we currently are providing it at. Okay, thank you.
Thank you. Have a good night.